Good afternoon, everybody. We're going to give it another couple seconds to let folks get into the webinar. Welcome. If you're just joining us, welcome. I'm going to give it another few seconds to let folks into the webinar, and then we'll get started. Okay, I am going to kick us off, and undoubtedly we'll have some folks continuing to join as we go. We know it's a very busy time for everybody. So we're especially grateful that you are here. Welcome to this independent sector webinar focusing on the health of the nonprofit sector and our recent 2024 sector health report. I'm Jeff Moore. I'm the Chief Strategy Officer here at Independent Sector. And again, I want to extend a very warm welcome to both our members and to our broader community of nonprofits and philanthropies that are joining today. Before we get started, let me just make a few housekeeping notes. That always comes at the top of a webinar. First, just to let you know that this is in fact being recorded and closed captioning is enabled. If you have questions over the course of this conversation, please do use the Q&A function in the Zoom webinar to submit your questions. Staff will review them and then pass them on to us as we go. So thank you. That is it for housekeeping. So let me welcome our two guests today. Joining me in the conversation are Dr. Akilah Watkins, the CEO and President of Independent Sector, and Janine Kaminote, an IS board member and new chair of our Public Policy Committee, I would also note. And Janine is the Executive Director of the National Urban Indian Family Coalition. So thanks both for being here. The aim of the conversation today is to share, as I said, the latest data from our 2024 health report. But we also recognize that it could feel a little tone deaf, maybe a little academic to jump into a report that's been out in the world for a little bit when so much has been happening over the course of the last couple of weeks. So we wanted to take a moment just to kind of reflect on what in fact has been happening over the course of the past couple of weeks and how we're carrying it as leaders in the sector. So I'm not telling you all anything you don't know. The past few weeks have challenged the ways in which charitable nonprofits think and work to advance an equitable and just democracy, and have put into doubt critical resources that come into and flow through nonprofits into communities coming from government sources. But amid all of what seems like a lot of chaos here coming out of DC, there is one thing that we absolutely know that is absolutely not changed. And that is that a healthy, trusted, and equitable charitable sector is essential to building a nation in which all people can thrive. So that's why we're here today to talk about the health of our sector. So let me turn to Akilah and to Janine to share some of their reflections on the times that we're navigating. They've been talking to lots of folks, undoubtedly, and I would love for them to say a little bit, not only about what they've been hearing, but about what gives them hope. So Akilah, let me turn to you first. As I said, I know we're all getting scores of emails and phone calls every day. And I'm wondering, as you have those conversations, what are some of the themes that you're hearing that relate directly back to the topic of the conversation today, a healthy sector?
Thank you, Jeff, for that. And Thank you, Janine, for joining us. And again, congratulations on your new role as the chair of our Public Policy Committee. I know we're geared up for an important year ahead of us. So, in terms of some of the key themes that I have been hearing from sector leaders, big and small, all over this country. I think a few sort of salient points. One is that a lot of nonprofit leaders feel that the ground is sort of shifting beneath their feet, if I can be honest. So, going to places like independent sector has become extremely important to the sector because people need to know, where can I go for good, reliable information? Where can I go that is going to be safe? Where can I go and hear various perspectives about the political environment in which we are currently in? So I'm hearing that a lot, and I'm hearing that people really count on reports such as the Sector Health Report and other research and advocacy and public policy tools that we currently are sharing. I will also say that the sector is strong, and I feel like people know that this sector has braved many, many storms before. We just come out of COVID. We braved the financial and housing crisis of the 2008, 2009. And so we have built a muscle around being deeply resilient as a sector. So that sort of spirit is deeply alive. But people also understand that there's going to be a lot of work ahead of us. So a strong sector is going to be needed to brace for some of the challenges we are confronted with. Um, but people know that we have the muscle memory for it.
Thanks, Akilah. Janine, so you and your network are, on the frontline communities across the country. What are you hearing? What do those in your network say they most need right now? What kind of advice are you giving them?
I think like a lot of folks, there's a lot of uncertainty right now. And I think in particular, as we look at human services, the human service nonprofit sector, I think you get an outsized amount of what we call civic funding, federal, state, city, county. A lot of that is federal funding that's coming pass through the counties and states. So there's a lot of uncertainty. There's a lot of questions. Are seeming to change on a daily basis. So it's a lot of wait and see. But while we wait and see, our services still need to continue. And so, one of the things that gives us hope is one that we have organizations like independent sector who we can turn to get sort of latest analysis, latest information. There's just so much happening. We're all drinking from a fire hose right now. And I think anytime you can have an organization that can stand stable and be the amplifier and that mouthpiece for the sector, I think that becomes an enormously important role. For our organizations, what gives us hope is that, like, most of the nonprofit sector, these are folks who have dedicated their lives to doing good in the world. These are folks who have dedicated their lives to the transformation of our communities into something better, into something healthier. And so the nonprofit sector to me has always the reason it stands while so much around us is in chaos is that those organizations become the stability within communities because they're staffed by those communities. And I think when you're staffed by the community and working for the community, that gives a strength that nothing else can mimic. And I think that that's sort of the messaging that our organizations are really feeling. It comes with no little amount of uncertainty because of the way things are right now, but their role remains the same, and it remains even more important, and specifically for our community because because the Native community is culturally based. For us, we turn to, I've been telling everybody that we always have our core cultural values to turn back on as communities, and we think that those core cultural values are not just for the Native community, they're for the human community. So I'll leave it at that.
Thank you, Janine and Akilah both. So, two themes, right? Just really important for us to remember in times like we're currently navigating, that it is our sector in so many ways that actually creates stability and community. And we can't forget that. And then Akilah, to your point, just remembering it can be oversaid, but we were built for this, right? We as a sector, right? We're strong. These are difficult times. It's not to dismiss the challenges. They are very real. But there is a strength in who we are and what we do. And a strength in the connection to the communities we serve that we can't forget. So thank you both. I am going to pivot us now to the report. And I'm going to ask Bernice if you can pull up a couple of slides. I promise not to spend a lot of time on slides, but wanted to give just a few very quick headlines from the 2024 report. The full report is, of course, available on our website, and I know we'll drop a link into the chat as well. And do hope that you spend a little bit of time with it. Again, want to remind us, and this is the independent sector vision, but I think if you're operating in the C3, C4, in the nonprofit space, in the charitable nonprofit space, at some level you connect with what is here, right? That at the end of the day, we know that a healthy sector, right, is essential to getting to a place where all people in this nation are thriving, and they're thriving in a vibrant civil society and a just democracy. And so then that begs the question, what is health? So we have a framework here at IS that we've been working with and improving. It's still not perfect, but for about 6 years now. And so this is kind of our health diagnostic, and it's got 4 lenses, right? So not surprisingly, we would say that one of the first things we want is to make sure that organizations in our sector are financially robust. And we'll talk a little bit more about each of these as we go. We want to make sure that organizations in our sector, philanthropy and operating charities both, right, are powered by a workforce that is healthy and thriving. Right. We want to make sure that charitable nonprofit organizations are trusted and well governed, and that they are effective in their work. And finally, we want to make sure that nonprofit organizations, as allowed by law, are informed and active advocates. So these are 4 ways in which we think about trust. So I'm going to ask Bernice if we can go to the next slide, and we'll dig into each of these, and one more slide on. Thanks, Bernice. Again, I am really skimming just the top. Do encourage you to get into the report to see more of the detail, right? So let's talk about the economic contribution and the economic strength of our sector. This slide has 2 critical pieces of information. One is that, the nonprofit sector is a very significant contributor to the economic engine of the United States. We're somewhere over 5% of the American economy, gross domestic product, right? So we're not nothing. We have real economic consequence. In 2023, as you see, the sector grew about 3%, which matched the overall economy. And the troubling piece of this is that one of the most critical sources of resources coming into the sector comes by way of contributed revenue from individuals. And here we have a pipeline problem. And it is both a pipeline of donors and it is a pipeline of dollars, both of which are moving in the wrong direction. The year-over-year change on donors, and this is a trend that's been going on for many years, continues downward. And despite the fact that we saw a bump coming out of COVID in terms of the dollars being contributed, right, that has now begun also to turn in the wrong direction. And then you see finally here that in terms of retaining donors year over year, we're also seeing a fall off. So we have some problems here. We'll talk a little bit more in a moment about how to deal with it. If we can go to the next slide and one more on. Thanks, Renise. So again, we talked about the economic contribution, somewhere between 5 and 6% of gross domestic product. We also are a major employer. About 13 million paid employees. In fact, that is more than the manufacturing sector in the United States, right? Paying over 870 billion in wages. We also know that that workforce, and Akilah will say more about this in a little while, no doubt, is really burned out. And one of the things that we have spent the last year doing as independent sector is working in partnership with United for Alice. Akilah will probably say a little bit more about what Alice is all about, but it's a methodology to understand how much of the nonprofit workforce is actually struggling, paycheck to paycheck. And what you'll see here is that a little more than 20% of our workforce is below the Alice threshold. They are struggling paycheck to paycheck. And if you back out, or if you zero in, let me say, on certain subsectors like the arts, like entertainment, like social services, those numbers, in fact, are much higher. Can we go 2 slides on, Renise? We'll talk about trust and governance. So as you may know, part of the annual health report is actually drawn from an annual survey that we do in partnership with Edelman Data and Intelligence to measure public trust in philanthropy and in nonprofits, and we look at them separately. We do this every year. These are the largest trust surveys done of philanthropy and nonprofits in the country. And there was some encouraging news and there's some discouraging news in what we saw in the 2024 release. The encouraging news is that, in fact, our overall trust numbers for nonprofits popped back up to the #1 spot in 2024. It had been trending down over the course of the last few years. It popped back up. We will see whether or not that is sustained, right? But there are some troubling numbers under this that we'll get to in a moment. But before we get off this slide, I also want to draw your attention to, if you go 1, 2, 3, 4 bars to the right, look at the philanthropy numbers. Typically, trust in philanthropy as compared to operating charities lags. It continues to lag and it was down. Also look at that 3rd bar. Trust in people in your local community, down by 13 points. So good news, bad news, and we'll come back to this in a moment. Okay, Renise, let's jump 2 slides forward. Great. So advocacy, right? We know that the systemic changes that we seek in the world as nonprofit organizations, they don't happen by themselves, right? That takes our voices individually and collectively. So advocacy is a critical measure of health, we believe. And from research that we commissioned and then launched in late 2022, and then have continued to carry out over the course of the last couple of years, we learned something really troubling, that nonprofits, despite the fact that we are we are absolutely dependent upon the use of our voice to move our missions. Only 31% of nonprofits say that they actually engage in public policy advocacy, which is down dramatically since this was last measured 20 years ago. Bernice, I think we can jump. Great. So I'm going to take us into a conversation now about each of these four, right? We'll start again with economy and finance, going back to that first slide. So again, to reiterate, we know that we play a major role in contributing to the economy in the country. We know that we have a pipeline issue in terms of dollars and donors. And we know, right, highlighted by the last couple of weeks and backed up by new research just released in the last couple of days from Urban Institute, and I'm going to look at my notes here for a moment, that three little factoids coming out of the nonprofit trends and impacts data tables that were just released. And this is about public resources coming into nonprofits. First, in 2023, 2 out of 3 nonprofits received a government grant or a contract. Second point, in the same period, over 1/3 of nonprofits surveyed as part of the panel received more than 1/4 of their revenue from government sources. And finally, third point, again, of the nonprofits surveyed by Urban, about 2 in 10, so roughly 20%, are receiving more than half of their revenue from government sources. So Janine, let me turn to you and just say a little bit, if you could say a little bit more about the nonprofits you're working with and how, as they step into their work day in, day out, how are they processing this potential for disruption of funding flows from government sources, and what do they most need right now?
Well, I mean, if we're going to be honest, it's a little bit of hair on fire right now. Again, it's sort of that uncertainty. When we surveyed our organizations, on average, about 9 out of 10 of our organizations reflected over 90% of their budgets coming from the government at every level. So, as we look at these potential disruptions in any of that kind of funding, there's a lot of trepidation on the ground right now. I think a lot of them are very quickly realizing, sort of your last slide point, that the role of advocacy actually is really, really important in public policy, and sort of understanding the interplay between public policy and the resources that follow public policy. So, you know, it's so early on in this that I think our right now, our little sector writ large is feeling a bit lost and like trying to figure out what's going to happen, how it's going to happen. There's a lot of talk about reserve funding. Do we have enough in our reserves to cover any potential disruptions? A lot of nonprofits who get government funding are getting government funding on a reimbursement via the reimbursements. And so you kind of have to be looking at your reserve funding. We did a survey a week and a half ago with our nonprofits about how many employees they would need to lay off if the interruption in government funding were to stand. And they were looking at about a quarter of their workforce would be laid off. So again, there's a lot of fear and a lot of determination to begin that interplay with policymakers.
And it sounds like a need for regular information, right? Because there's so much coming at us, right? Just interpreting what's coming at us. Thanks,
Yeah.
Janine. Akilah,
And money.
yeah, no, go ahead. Go.
No, I was just gonna say, and money. So I think this is where
And
the
money, information and money.
philanthropic
Yes.
sector can fill in, can be of service to the nonprofit sector.
Thanks, Janine. Akilah, I'm gonna pivot to the other piece of that economy and finance slide, which was around charitable giving, right? And we are on the edges of a major tax debate in the new Congress, right? The 2017 Tax Cut Jobs Act, the Trump tax cuts expire at the end of this year. So all of this goes up in the air for renegotiation right now, which presents opportunity for us and potentially some challenge. You want to say a little bit about where the opportunity lies, specifically as it relates to charitable giving?
Yeah, absolutely, Jeff. So regardless of who won the election, we were going to have to go into tax legislation this year. So we have been busy at Independent Sector doing a variety of things. One is that we have developed a tax legislative agenda, which more than happy to share with folks. But as it relates particularly to the charitable deduction, this is an opportunity for us to make sure that every American has an opportunity to give, right? So the tax debate offers a unique opportunity for our sector to address charitable giving. As we all can recall from your earlier slide, we realize that donors are down, charitable dollars are down. And so this is a particular area, interest area to our sector, particularly now. And so we realize that the charitable deduction is one of the areas that the entire sector can coalesce around. So we are very, very aligned and have been working on both sides of the aisle around this. And our core aim here is to make sure that all people who choose to donate to the charity of their choice get the same incentive to do so through the tax code, right? So we want to incentivize giving, and so the new sort of tax code will give us an opportunity to do that, to incentivize Americans around that. And we are extremely grateful for leaders like Senator Langford for again reintroducing the Charitable Act a few weeks ago, which would make sure that all Americans who donate to a charity get to claim the charitable deduction, whether or not they itemize their taxes. So this is really, really big, especially when we think about millions of Americans who file a short form and are still giving, but not able to get that charitable deduction. So this would actually help to correct that. And we really applaud Senator Langford for being a leader on this legislation, so important to our sector.
Thanks, Akilah. And we know, right, given that the little mini experiment during COVID, when there was a small deduction, right, this really works. This is a policy that works. So there's a question that has come in kind of two parts. Maybe I can take the first part. Sorry, just looking at the chat. So I can take the first part and then turn to you for the second part. The question is about, are we doing a good enough job of measuring contributions of the sector, both financial dollar contributions to the economy, but also the non-financial contribution? Like, are we capturing it all? And so, I can very quickly say on the financial side, we believe there is a lot that we are not actually able to account for because of lack of data. Right. And there are ways to get at this. There is something called, for researchers who are on the line, something called a satellite account. Think of it as like a magnifying lens that could be put on the sector to help reveal the larger economic contribution we're making by way of our gross domestic product. That is something that we continue to advocate for and will be advocating for with this administration. Let me turn, Janine, to you and Akilah on this question of, how do you account for the other side of the equation, right? The non-financial contributions we're making. That can we even measure that?
So I'm more than happy to jump right in. So I think a couple of things. One is that we know that nonprofits, contribute in a variety of ways, right? So like you said, Jeff, we contribute directly to the gross domestic product of the country. And, having access to our data is going to be extremely important to us. But there are some other ways in which we contribute. I mean, one of the most clearest and direct ways we contribute is we provide an opportunity for Americans to civically engage, right? And civic engagement is huge, right? It's how people feel connected to their community. It's how they build relationships. It creates pro-social behavior. So again, this is, can we sort of measure what we have done at Independent Sector is every year we have the value of volunteer time. We try to quantify um, sort of the hourly rate of volunteers. But to be honest with you, Jeff, to be able to to quantify or to measure the extent in which nonprofits add value for individual residents, and how they're able to deeply contribute to their community. I would love for us to really think about both the sort of economic, but also the sort of social impact of what that means. I think the other way that we contribute is by actually providing high quality services to Americans
Yep.
in our community, right? And when we think about from the very small to the very large, right? So things like, Meals on Wheels, right? When we think about how most young people in this country actually learn how to swim. And, when we think about, hey, taking your child down to the local Y, these all create values, right? They create value in local community, and then they create values for Americans. And when we think about how most Americans in this country are working, trying to sort of manage what their monthly financial bills are, being able to think about how my children actually have good quality after school care, they can learn how to swim, they're able to move back and forth safely. I think all of those are ways that nonprofits deeply contribute through their programming. And we haven't sort of measured
Yep.
sort of the social fabric that they create in the country.
Thanks, Akilah. I want to keep us moving, but Janine, anything quickly that you might want to add to this question?
Say very quickly everything, echoing everything Akilah just said, but also that nonprofits, within our nonprofits, we actually try to measure that kind of impact. And we do that through how many people attended cultural events, how many people attended feasts, how many people are in each family. When a nonprofit helps an individual, they also help their family. So it's a ripple effect. You're helping way more than one person. So understanding sort of that interplay between just counting your clients and counting your impact. Your impact is much, much bigger than your clients. And also real simple things like social media. Like we actually have our organizations measure their social media engagement, and we quantify that every season.
Thanks, Janine.
Jeff, and I know you're going to go into this, the last piece is social trust. I mean, I have to just say that
Yep.
this is the one thing we help to contribute in this country.
And we're going to come back to that, to
Yes.
the social trust issue, but I am going to turn us to workforce. So in addition to the slide that I shared, there's a lot in the report that I didn't mention. I'm going to pull out just three or so things that are really worth thinking about. First of all, the nonprofits with the highest rates of financial hardship among workers included, I think I might have mentioned this, those in the social assistance space, arts, recreation, religious organizations, right? Black and Hispanic nonprofit workers, twice as likely in the Alice frame, right? Twice as likely as white workers to be experiencing financial hardship, living paycheck to paycheck. And 1/3 of nonprofit workers with disabilities are struggling in the same way. Finally, and not surprisingly, unfortunately, nonprofit workers with children were at higher risk than anybody. So Akilah, I'm gonna turn to you for two things. First, how do these findings square with much of what you have heard, or do they square with what you heard in your nationwide listening sessions? And then I'm going to give you the second question at the same time, and you can pivot from one to the other. So as you think about the work that IS is now doing with United for Alice to better understand the health of our workforce, what most excites you about that partnership? Oh, you're on mute, Akilah.
Sorry about those. Thank you, Jeff. So I will start out by saying we are extremely excited to be partnering with United Way of Northern New Jersey around this ALICE data. It is very important, and it's something that I heard on the nationwide listening tour, that the nonprofit sector is extremely exhausted, right? We were exhausted coming out of COVID because many of us did not get time off, and we still had to figure out a way to service 330 million Americans going through a worldwide pandemic. And so we didn't come out of that, sort of the same. And we heard, and I heard that over and over again. And so, with this research that we're doing right now, looking at the percentage of nonprofit workers who work close to 40 hours a week and still are not able to meet their financial monthly obligations, what has excited me is the fact that we are actually uncovering and looking at this population to begin with, right? For many of us, this is the population that has done a lot of the invisible work. And they are being people of color. They are being specifically women of color doing this work, particularly Black and Brown women that are working tirelessly in communities across this country, keeping them together, all the while struggling financially to meet their own financial obligations. And so I think that our work around ALICE, for the first time, we have highlighted that this is invisible labor in our country, in our sector, and we should work to make them whole, right? So with the ALICE data, a couple of things that we're looking at. So ALICE is an acronym that means asset limited, income constrained, but employed. And it is a methodology that has been used looking at how different populations within the country fit within this asset limited category. So, and this is the first time that we have actually turned this methodology onto a sector, right? And so that is why this work is so groundbreaking. And so part of what we have found, and Jeff has shared about this, is not only are we uncovering who is struggling, where we also can look at regional differences. We can look at how different individual sort of variables impact our workforce. And this is the first time now we're able to do targeted approaches to being able to make sure that the 13 million Americans that get up every day to service or work on behalf of the millions of Americans every year aren't themselves struggling, financially struggling. So I will just say this to close, is that this is important work for IS, and this is work that we're focusing on. And now we actually want to focus on what those solutions look like, because we think our sector should be a place that people can come and work and have financial dignity as they work through their professional lives and as they retire. So we're looking at a suite of options here to not only just pay people, but how do people really think about wealth building throughout their career?
Thanks, Akilah. Important to, for all of us to remember, thanks for the reminder that, this research with Alice is kind of groundbreaking and extremely exciting, but not done for the research sake. At the end of the day, right, it needs to drive to some policy or practice change that makes workers stronger. Janine, so again, as you think about your networks, right, and the work they're doing in Indian country across the nation, right? How are they holding this tension between moving the mission and caring for themselves as the nonprofit employee? It's a hard question, I know, but
Yeah, that's a really big question, Jeff. Um, I think, but so just a real quick story that was told to me by an elder once and you'll see why this is relevant here in a minute. So during the Indian Wars, the tribal leadership had to figure out who was going to take away the guns and who was going to treat the wounded. So the role of these nonprofits, and not just Native nonprofits, of any community who is vulnerable in this country, the role of the nonprofit is often to take away the gun, advocacy and policy, and treat the wounded, service. So, our nonprofits are really in a place right now where they're trying to figure out how to take away the gun. The providing service for the wounded is something that our communities have done, the indigenous communities have done for literal hundreds and hundreds of years. So I think for our nonprofits, that it's that tension between, sort of self-care for yourself as a employee, and also, having the infrastructure of a nonprofit to take care of. It's always going to be the community that comes first, and that is sometimes what can create some instability from the structural side. So, to Akilah's point, when we surveyed our organizations, only about 50% of them have healthcare. Healthcare remains a really, really big issue for the nonprofit sector, because it's really expensive. So, sort of as our nonprofits begin to navigate this new reality, I think that there's just too much right now that's unknown. And so I think we're only a few weeks into this. So I think we'll know a little bit more when we get a little bit farther. But for right now, it's really still navigating this murky water we're in. That's not a very good answer, but it's the
that's
truth.
a very good answer. Appreciate that. Thanks, Janine. I am gonna move us to the trust topic. And again, just to highlight a couple of things that weren't on the slide, folks didn't see, right? So we talked about the fact that overall trust in nonprofits increased in our last survey, right? Which is a great thing. However, actually, let me add one other really positive thing, right? That Americans generally look at nonprofits as better equipped and more trusted than anyone to actually heal the divisions in our country. So really important to remember that. On the other hand, trust in nonprofit organizations declines dramatically when the individual connects the work of a nonprofit and government advocacy or nonpartisan voter engagement. When they think of nonprofits in that space, right, trust goes down. So that's not such a good thing. So, trust is our currency, right? It also has a shelf life. And there's a question that has come in that I'm seeing from the team here about how it is that, whether I'm a nonprofit or I'm a philanthropy, right? Like, how am I recognizing that trust diminishes over time? It doesn't have a shelf life of forever. Like, what should I be doing to be building that trust on the ground? So I'm going to turn that to both of you. Whoever would like to start.
Sorry about that. So I think a couple things in terms of trust. First of all, we measure social trust every year at IS, and we're moving into our 6th year of measuring it. So it's something that is important because, to Jeff's point, it is our social currency. And we should have a pulse on where Americans are at in terms of the institutions they turn to, right? Especially institutions they turn to in times of crisis. And so I'm very proud to say that nonprofits are the most trusted institutions in the country. With that being said, how they actually stay the most trusted or continue to build and grow trust. Some of what we have learned from our research are a couple of things. One, when and if nonprofits actually have an outside entity verify who they are, or can speak to how effective and impactful they are, that actually helps, right? So having a third party entity do that, and so it's something that we're holding and digesting at IS. I think, the other way that nonprofits continue to build trust is working very closely with volunteers. As people are deeply engaged in their local nonprofits, they're sitting on the board, they become their donors, they're engaged in their services. And this is very, very important to build trust, because you build trust by doing, right? So trust is not like an abstract thing. Trust happens when people are building community together, and actually doing things together. And then I will say, finally, transparency is something that we found to be very important. So, as nonprofits, share, financial and decision-making processes, with their constituents, again, important information. It helps to sort of remove the mystique of, how organizations sort of function, and sort of how resources flow. So having transparency is extremely, extremely important for nonprofits. So
Probably more so now than ever, right? I mean, we are.
more so now than ever. And I will say, finally, is spatialness, right? You being able to go down the street and see your nonprofit every single day, and that they're part of your community, is very important. We actually think sort of proximity is probably one of the key drivers for building trust, because a lot of the other institutions we see, there's social distance. There's literally distance.
Yeah.
I can't sort of get in my car and drive to, I mean, maybe I can because I live near DC, but if you actually look at the federal government and where their trust numbers are, or other institutions, you can't sort of just drive to a building where that happens. But for nonprofits, a lot of us can drive to our local food pantry, our local youth organization. They're in our communities, they're in our schools, they're in our churches. So we think all those things drive trust.
Yeah, the research shows again and again, proximity really matters. Janine, I'm gonna put the second question to you, right? So the research tells us, right, we're enjoying this sort of trust reservoir as a sector right now. How should we use it?
I think, also, you're just giving me all kinds of big questions, Jeff. Um,
I have some ideas if
uh, I think that when people see themselves reflected in their institutions at every level, that's what inspires trust. And so as we look at the nonprofit sector, the reason, to my thinking, the reason that we have such a high level of trust is, one, the proximity that you both just spoke of. We know that to be true, but also, who is the person doing this, giving my child swim lessons, providing food, health, education, all of these who's working with our families with the CPS systems or child welfare systems, etc. So I think that, to my thinking, you maintain that trust by, one, always ensuring that the nonprofit sector is reflective of the communities that they serve, um, and that the nonprofit sector is also aware of our responsibility to ensure, I know that you said earlier that trust goes down when there's, when civic engagement or, political engagement or voting, whatever, gets involved. But I think that can also be massaged because I think there's an educational piece of this that the nonprofit sector can play, again, in ensuring that our bureaucracies writ large are also reflective of our community. So I think that in, making sure that the nonprofit sector has a unique positionality to be able to sort of interpret, sort of these larger systems for the broader community. And they can instill trust to some degree in, how things work. I think a lot of that distrust really stems from a lack of not understanding how, how all of how these big systems work, and why isn't my family, benefiting from this, those kinds of things. So I think for me, you know, using that trust to be able to both advocate and educate our populace in America about who we are, what the sector means, at all levels.
Thanks, Janine. And a really important point at the end there, and I would just add one additional point. So, and our government relations team would bang me over the head if I didn't say this, but we should be using the trusted status that we have right now to talk to our policymakers about what our sector needs, and most importantly, what our communities need, right? So let's use the trust, as advocates. So we've only got about 9 minutes left, and so I am going to turn us finally to the last piece of the report, which was about advocacy. We remember that headline, right? That the numbers are down dramatically, right? And that the stuff we look to see happen in the world doesn't happen unless we're using our voices. So Janine, I'm going to turn first to you. What concerns you most about that decline? And again, I'm asking you to reflect back what you hear from your networks. What do your networks most need right now to be better advocates?
I think C3 101, knowing that, how do you measure that 20% that you can use for lobbying and advocacy and being the voice of your community. I think that, that was, so we, in 2018, we launched a civic engagement initiative, which has dramatically exploded as our organizations became more comfortable in recognizing that resources follow policy, policy follows elections, and that the bureaucracy, understanding the bureaucratic mechanisms by which resources are distributed, and those resources directly impact communities, whether it's child welfare or education or, food pantries, the roads we drive on, the buses we take, there's no part of the system that we live in that doesn't have a public policy component to it. And sort of having nonprofits not just understand that public policy component, but also know that you're not breaking any IRS regulations by telling your community what those policies are, and educating community about the power that they actually have in our public policy arena. So, that was a big one. And then actually, that was the only one. It was really just having nonprofits understand sort of the parameters by which they can work, and still maintaining, nonpartisanship. Like, this is a part of the law.
Yeah.
And so I'll just leave it at that.
So, and thank you, Janine. And I am going to remember probably one of the first conversations I had with you when you said, Y'all don't need to tell me how important it is to get my networks advocating. That is in our bones. We know how to do this. What we need is funders to make it possible for us to do that. So I don't need you to elaborate on that. I do want to turn to Akilah for a final word on the advocacy piece. And then Akilah, if you want to close us out and wish everybody well.
Will do. Thank you so much. Well, I will say about advocacy, it's one of the things we have been following over the last several years, and we are concerned about it. The nonprofit sector is a very powerful sector, socially, economically, and we don't want to leave our power on the table. And over the last 20 years, our our sort of entree into policy and advocacy has retrenched quite a bit. And Jeff did share about that. About 22 years ago, about 60% of nonprofits participated at both at either a local, state, or federal level. That number is about 31% today. So it does worry us because we are leaving power on the table. What we have learned from our nonprofits, and Janine illustrated this, is that it's rules, it's tools, it's resources. It's, that's what we need. We need the rules to be very, very clear. And that's part of our job at independent sector, is to work with IRS and federal policymakers to make sure the advocacy rules are very, very clear for our sector. And then really thinking about what sort of tools and trainings are needed. How do we train policy directors up? And how do we train them together? And then dollars. Most nonprofit leaders are literally trying to keep the lights on and working really hard to service their constituency. And so policy and advocacy, which we know are important because those are the ways in which we tackle the systemic issues that we're working on, because we're all working on the outcomes of these systemic issues. We know that this is important, but a lot of us don't have the sort of the spaciousness, the resources needed to be able to do both. And so, and I know, just like we all got into this work because we deeply care for our communities, and we're going to focus on servicing our communities. So that is why resources are really important. But the other thing that our research has showed us is that coalitions are extremely where we need to make our deep investments, because when nonprofits have to advocate on their as solo individual organizations, about 12% of them do, right? Because it is expensive in terms of time and resources. But when they do work within coalitions, that number jumps to about 57%. It creates opportunity for us to partner. It creates leverage. It creates cover. So we are a real proponent of coalition building. And I would also invite you all to a new product that we're launching at IS called Coalition Connection, which is a tool that we currently have on our website to help nonprofits actually coalesce around their given mission area. So I encourage you all to look and utilize that resource. So with that being said, I would like to thank you, Jeff, and you, Janine, for being a part of this important conversation today. I also want to refocus our attention on some key points to wrap us up. We talked today about what IS and other organizations are doing to defend and strengthen our sector. But I want us to be sure to say that even in this crisis that we're currently in, research is critical to make the case for our sector, both in the moment of crisis and in the long run. Research is also crucial to informing how we advocate for our sector. Thanks to our research, we know how important coalitions are for supporting organizations in their advocacy efforts. We are working to strengthen those coalitions every day. Some of that effort will be shared in a webinar next month, focusing on our research and capacity building around nonprofit advocacy. So please stay tuned for more information on our website and in our emails. And if you're not already a member of IS, I encourage you to join. More information about membership is posted in the chat and available on our website. Please use these last few moments to fill out the post-event survey. The link is also posted in the chat. Again, I would like to thank our esteemed panelists, and I thank you all for joining us today. Thank you.